One of the most important concepts we need to learn about in physiology is the idea of homeostasis. Many things are homeostatically controlled. There is homeostatic regulation of many parameters within the body. So what does this word homeostasis mean? Well, homeo in this context means the same, as in homogeneous. Something that's homogeneous is the same throughout. It would be the converse of heterogeneous, which means it's different. So homo means the same in this context. And stasis means standing, or the state of, or the position of. So homeostasis is maintaining the same standing or maintaining the same state. The same state is maintained. And there are many states and parameters in the body which need to be maintained within very narrow limits to maintain physiological conditions. The conditions in the body must be physiological in order to allow physiological processes to go on. And physiological processes are not random, they are highly controlled and dependent on many parameters being correct for their normal function. You see, the body is made of many billions of cells, and each of these cells is like a life unit in its own right. It's a little biochemical factory where there's lots and lots of things going on at any one time. Lots of complex biochemistry is going on inside each of the billions of cells in your body right now. And the life of every cell is dependent on the physiology which is going on inside that cell. And the physiology is dependent on the biochemistry that's going on. The cell is essentially a biochemical unit. Lots and lots of chemical reactions are going on. So, for example, a substance A might be converted to a substance B under the influence of an enzyme. Now, an enzyme is a biological catalyst. It is something that facilitates or increases the rate of a biochemical reaction. And all the complex biochemistry in the cell, which is giving rise to the physiology, which is actually giving rise to the life of the cell, all of that biochemistry is facilitated by enzymes. Enzymes are controlling the stages in the biochemical process. They're facilitating the conversion of one substance into another. They're controlling the rate at which this happens. Enzymes are absolutely pivotal biological catalysts. So we need normal functioning of enzymes to have normal functioning of biochemistry, to have normal functioning of physiology, to generate this rather strange phenomena that we refer to as life. We must have the enzymes. And enzymes are actually complex proteins. They are consisting of chains of folded and interlinked amino acids that interlink in a remarkably complicated way to form complex three-dimensional structures. And the structures that are formed by the enzymes must be precise. They are not random, they have a precise shape. It's called the molecular architecture. Exactly the right component of the molecule must be present at exactly the right place to facilitate the biochemical transformations that they supervise. And because the protein structures are so precise, they need very precise parameters to work in. For example, if you alter the pH, the acidity and the alkalinity, by a very small amount, then you're going to actually change the shape of the enzyme and it will become inactive. It will no longer work. So enzymic activity is dependent on very precise regulation of the pH of the internal environment. If the internal environment becomes too acidic, that's called an acidosis. That's pathological and will become life-threatening. If the internal environment is too alkaline, that's termed an alkalosis, and again that can be a life-threatening condition. So pH needs to be maintained within very precise margins to facilitate normal enzymic function. So when you're working on the wards, you'll probably come across patients getting arterial blood gases taken, where some blood is taken from an artery. And one of the parameters that test looks for is pH of the plasma in the arterial blood, and that should be controlled between 7.35 and 7.45. So if the pH is less than 7.35, that will be acidosis. If the pH is greater than 7.45, that will be alkalosis. It's a very finely tuned parameter, and it has to be to maintain enzymic function. And enzymes also depend on very fine regulation of temperature. If the patient's temperature goes up, that's a hyperthermia, as might occur, for example, when the patient is pyrexial or febrile. And if the temperature goes down, that's hypothermia, and both are life-threatening conditions. So temperature needs to be maintained within a physiological range, which is normally about 36.5 to 37 degrees centigrade. If the temperature goes down, the enzymes start working slowly and eventually stop working altogether. If the temperature goes up, the efficiency of the enzymes is again reduced, but eventually the proteins in the enzymes will become denatured by the increase in temperature. They will alter their shape. For example, there's a protein called albumin, and when you crack an egg and put it in the frying pan, the white part of the egg isn't white at all, it's clear. That is albumin in a physiological state. But then when you cook the egg, that goes white. The albumin changes from being clear to being white because it denatures as a result of the heat. The physical shape of the albumin molecule changes completely. And it's the same with enzymes. If you warm them up, the shape of the molecule will change and they will become completely unable to perform their physiological function. Their biochemical transforming powers will be lost. That means the biochemistry of the cell won't work properly. That means the physiology won't work properly. That means it won't generate life, and indeed that cell will die if the temperature goes high enough. Now, water is sometimes described as the living matrix. It is the medium in which life takes place. All biological life takes place in the context of water. There's always got to be water about. And if there's not enough water, we would call that dehydration. Lack of water causes dehydration of the whole organism, of a person, and lack of water can also cause dehydration in a tissue or an organ, or indeed in an individual cell. There must be just the right amount of water. But there again, you don't want there to be too much water, because then the patient would become soggy. Now, an example of sogginess in tissues is edema. Edema means that there is too much water in a particular tissue. And you may have seen systemic edema. Now, systemic means in the systems of the body, actually excluding the lungs. So if someone's got systemic edema, you might have noticed that they develop puffy, swollen ankles. That patient is a bit soggy in that area. They are edematous. Or you might have come across a patient with heart failure who develops pulmonary edema, where the lungs become too soggy. There's too much fluid in the lungs. And if there's too much fluid in the lungs, the air can't get in, and that person can't get the oxygen they need and cannot get rid of the carbon dioxide they need to get rid of. So the amount of fluid in the body needs to be precisely controlled. It's a homeostatically regulated mechanism. So if there's too much fluid in the body, you're going to produce larger amounts of urine to get rid of that excess amount of fluid, to get rid of that excess volume of fluid. If there's not enough fluid in the body, then you're going to retain more fluid, and the urine is going to become darker and concentrated. So we can control the amount of water that's excreted to try and homeostatically regulate the overall amount of water in the body. And if you're short of water, if you're dehydrated, you will become very thirsty, and that will take absolute priority over everything else. You won't look for anything else or do anything else until you get some water to drink. The body is generating this desire to drink in order to maintain the homeostatic nature of the internal environment with reference to the amount of water that is contained within the body at any one period of time. Now, dissolved in the fluids of the body, there are many ions called electrolytes. An ion, you might remember, can be thought about as a charged atom. It can have a negative or it can have a positive charge. So, for example, there's sodium, which is Na+. There's potassium, which is K+. There's chloride ions, which are Cl-. And there's other ions like calcium as well, dissolved in the fluids of the body. So as well as having the right amount of fluid in the body, those fluids must contain precisely the right amount of electrolytes. Now, the reason that electrolyte balance is so important is because there are groups of cells in the body called excitable cells. Now, excitable cells are cells which generate an electrical potential difference across their membranes. They work electrically, and the two types of cells in the body that work electrically are nerve cells and muscle cells, and these must have the right concentration of electrolytes internally inside the cell and externally outside the cell, so that there can be an electrochemical potential difference across the cell membrane. And typically when a cell is at rest, that means it's going to be negative inside the cell and positive outside the cell. But then when the cell is activated, that charge is going to reverse. There's going to be a reversal of polarity, or a depolarization. The cell is going to change from being polarized to being depolarized. And in that case, the charge inside will become positive and the charge outside will become negative. And this is absolutely vital to generate nerve impulses and to generate muscle contraction. So, for example, if the brain's going to work, there must be the right concentration of electrolytes on both sides of the cell membranes, in the cells, in the neurons, in the central nervous system. And this means that these electrolytes must be available in the right concentration. If a muscle is going to contract, such as the heart, for example, it must have the right electrolytes on both sides of the myocytes, that is the cells in the myocardium that do the contracting. It must have the right concentrations of electrolytes on both sides of the cell membrane. That means the balance of these electrolytes in the body must be very finely controlled. And if they're altered, the excitable cells won't work. That means the muscles won't contract and the nervous system will not be activated. In other words, there can be no life if there is not the correct concentration of electrolytes in the body fluids. So these need to be very finely homeostatically controlled. So for example, if you eat lots of salt, you're going to feel thirsty and you're going to excrete large amounts of salt in your urine. If for several days or weeks you don't have access to salt, then you don't want to excrete the salt, so that's going to be retained in the blood and the amount of salt in the urine will be reduced. Or if one day you eat 3 or 4 bananas and you increase the amount of potassium in the blood, then again that will be detected and more potassium will be passed into the urine and will be excreted from the body. Conversely, if you don't eat for a number of days and the amount of potassium in your blood starts to drop, then the urine will contain less potassium. The potassium will be conserved in the body to homeostatically regulate the total amount of potassium that's in the body at any one time. So the electrolytes are homeostatically regulated in order to maintain homeostatic levels, in order to facilitate normal cellular function. Again, the homeostatic mechanisms are maintaining cellular physiology, and it's the cellular physiology that generates life. The level of nutrients in the blood also needs to be finely controlled. For example, if there's too much sugar in the blood, we call that hyperglycemia. It is an abnormal situation. Or if there's not enough glucose in the blood, that's going to be hypoglycemia. Again, an abnormal and potentially life-threatening situation. So the amount of glucose in the blood is going to be finely controlled. When the amount of glucose in the blood rises, that's detected by the beta cells in the pancreatic islets, and they produce insulin, and insulin lowers blood sugar levels. Conversely, if you don't eat for a period of time and the amount of glucose in the blood goes down, that's going to be detected by the alpha cells, and the alpha cells will release a hormone called glucagon, and glucagon will increase the amount of glucose in the blood by liberating reserves from stored carbohydrates, and indeed by liberating reserves in stored fats and proteins to maintain blood sugar levels within essential physiological parameters, absolutely vital for the maintenance of life. And as well as getting the good stuff to the cells, the waste products need to be removed. So all the time cells are generating waste carbon dioxide. The mitochondria use oxygen and glucose. The mitochondria in the cells produce energy and some water, but they also produce carbon dioxide. And if that carbon dioxide is left lying around inside the cells or lying around locally in the tissue fluids, it will dissolve in water and be converted to an acid called carbonic acid. And that is going to cause localized acidosis. The pH will drop. And if the pH drops far enough, the tissue will be damaged, and then eventually the tissue will be killed. So it's necessary to get rid of the waste products, just as it's necessary to get the useful products in. Another waste product that's produced by cellular biochemistry is nitrogen. Waste nitrogen is produced when proteins are metabolized, because proteins contain carbon, hydrogen, oxygen and nitrogen. And if the waste nitrogen is left lying around, that will react with the hydrogen in the water, and that will form NH3, which is ammonia, which is very toxic. Ammonia is a very strong alkaline, and it will cause alkalosis in the local area. Again, first of all, that will stop the local tissues from working. It will interfere with cellular biochemistry, and then it will kill the cells. So it's necessary to get rid of these waste products as well as getting the useful products in. And of course, when we're talking about getting useful products in, an obvious one that cells have an ongoing need for is oxygen. So it's absolutely vital that cells all over the body are supplied with oxygen. So the amounts of oxygen in the blood also need to be homeostatically maintained. If the amount of oxygen in the blood does start to drop, that's detected by various detectors. The brain is informed, the respiratory centre in the brain is informed and greatly stimulated, and that will increase rate and depth of respiration to try and get the oxygen parameters back up to their physiological normal levels to maintain oxygen homeostasis. Now, cells just don't do their own thing. They don't just decide what level of physiological activity they're going to carry out one day. It's regulated and controlled, so the body as a whole is coordinated. And one of the controlling parameters of cellular physiology is the amount of hormones that cells are exposed to. So hormones are chemical messengers. They're produced by endocrine glands. They circulate in the blood and tissue fluids of the body, and they will stimulate and influence cellular physiology in numerous ways. For example, there's a hormone called thyroxine. It's produced by the thyroid gland in the neck, and the thyroxine circulates in the blood, and increased amounts of thyroxine stimulate the metabolic rate of many cells. So if there's more thyroxine, many cells will be metabolically more active, producing more energy. Conversely, if the levels of thyroxine in the blood drop, then the cells will be less stimulated and there will be less metabolic activity in many billions of cells. So the metabolic activity, that is the total of biochemical activity going on inside the cell at any one time, needs to be finely controlled. We don't want too much metabolism. We don't want not enough metabolism. We want just the right amount of metabolism. And just the right amount of metabolism has to be stimulated by just the right amount of thyroid hormone. That means we need just the right amount of thyroid hormone in the blood. If we have too much thyroid hormone, we are hyperthyroid or thyrotoxic, and that is a pathological condition. It's abnormal. But conversely, if there's not enough thyroid hormone in the blood, the patient has hypothyroidism. And again, that's an abnormal situation. It's a pathological situation. So the amount of thyroid hormone in the blood is very precisely homeostatically regulated, not too much, not too little, so we get just the right amount of metabolism, not too much, not too little. It's kind of like Goldilocks conditions, isn't it? The porridge isn't too hot, the porridge isn't too cold, it's just right for physiology. Now, blood pressure is also vital for normal life. It is blood pressure that enables the blood to perfuse the tissues of your body. And blood pressure needs to be not too high and not too low. We want just the right level of blood pressure. If blood pressure is too high, well, that's called hypertension. That's abnormal. If patients are hypertensive, we would try and instigate measures to bring their blood pressures down again. But conversely, if the blood pressure is too low, that would be hypotension. And indeed, if the blood pressure is very low for a period of time, we call that shock, which is a life-threatening condition. So we don't want the blood pressure to be low. In that situation, we'd have to instigate measures to bring the patient's blood pressure back up again. So maintenance of normal blood pressure is essential. And there's many physiological mechanisms going on inside the patient that do ensure normal levels of blood pressure. When it goes too high, the body brings it down. When it goes too low, the body brings it up. And this is the same for all of these homeostatic mechanisms that we've been talking about. There are these internal physiological mechanisms which maintain homeostasis. But when these mechanisms fail, it's very often necessary for us to instigate clinical measures to reinstate the homeostatic mechanism. For example, if someone's dehydrated, we might give them a drip. If someone's hypotensive, we might give them intravenous fluids. When I say drip, I mean an intravenous fluid. But alternatively, if someone's fluid overloaded, we might stop giving them fluids or even give them dialysis to try and reduce the amount of fluids in their body. If someone's too cold, we will try and warm them up. If someone's too hot, under some circumstances, we will try and reduce the temperature. If someone's thyroid hormone is too low, we might give pills to increase the thyroid level. If someone's thyroid level is too high, again, we might give drugs to try and lower the thyroid level. If someone's blood sugar is too high, we can give insulin or drugs to bring it down. If someone's blood sugar is too low, we can take measures to increase someone's blood sugar levels. So normally the physiology is taken care of by the activity of the body working to maintain health. But in disease states, the body might not be able to maintain its own homeostatic mechanisms, and that's where we can often intervene to help the patient maintain homeostasis for a period of time until their own physiological mechanisms recover from the disease state, get back into a physiological state, and can maintain the patient's health for them once again. So it's very important that we understand this concept of homeostasis, because it's vital to life, and when it goes wrong, very often we are the ones that have to look after the patient's homeostatic parameters for a period of time until the patient recovers. Till the patient recovers. Till the patient recovers. Till the patient